for the health insurance of an individual was about $7,200, $7,200. And for a family of four, it was about $20,000. In Wisconsin, there were 310,800 people without health insurance. That's before the pandemic in 2018, 2019. 29,000 of those were Black residents, 63,700 were of Hispanic or Latinx descent, and about 10,000 were Native Americans. Blacks and Latinos were on average 2 to 3 times more likely to be uninsured compared with their white counterparts. Since this COVID pandemic has hit, 30 million people have filed for unemployment nationally. Over 200,000, the last time I checked, have filed for unemployment claims in Wisconsin. Nationwide, the New York Times just reports that 5 million people lost their health insurance in the last 3 months. And by the end of 2020, we're estimating that at another total of another 5 million for a total of 10 million who are going to lose their health insurance. In states that expanded Medicaid eligibility under the Affordable Care Act, the percent of those that are going to remain uninsured will go down to about 33% of that figure that I just cited. But in states like ours, in Wisconsin, that didn't expand Medicaid, or rather where it was actively blocked, that percentage is higher. It's about, it's closer to 60%. According to a Marquette poll, 50% of respondents that answered the poll in Wisconsin said they would avoid medical care even during this pandemic because they fear that the cost of the health care would be too much for their budgets. In the United States, 3.7 million Americans have been infected by this virus, causing 142,000 deaths as of today. The number of new cases continues to climb in many states, and the death toll is increasing. In contrast, in Taiwan, New Zealand, and Canada, countries that have universal health care, case numbers have flattened and the number of new deaths has sharply diminished. Thanks for just letting me rattle off those figures. I wanted to give a little bit context, but now we're going to go right into the forum, and I'm going to ask the first question, and multiple candidates are going to answer these questions sequentially. And so I ask when the candidates start speaking that they introduce themselves when it's the first time you've had the chance to speak by your name and and for the seat that you're running for. We ask that candidates keep the answers to the questions around 2 minutes so that everybody has a chance to speak. If you guys are running over 2 minutes, then we will give you a warning, let you complete the thought that you've started, but then move on to the next candidate. So the first question is, or the first discussion point rather, is nationwide, the COVID pandemic has caused a health and economic crisis that has led to 140,000 deaths or more, showed significant inadequacies in our public health system to prepare for a crisis of this size, and highlighted the lack of access of healthcare that millions of our residents faced even before COVID-19. How would you describe our response to the COVID-19 pandemic? How do you see it shaping the movement for Medicare for all in this country? And what have you noticed locally or heard while campaigning from your potential constituents? And the first respondent is going to be Sarah Yakub. Correct me if I said your name wrong.
Thank you, Richard. Thank you, Andre. Pleasure to be here with everybody. My name is Sarah Yakub. I'm the Democratic candidate running for Assembly District 30 here in Wisconsin. We are just outside the Twin Cities, encompassing Hudson and River Falls. To answer that very important question, what comes to mind are two parents. One who is telling us to eat our vegetables, and the other parent who is trying to be our friend and saying candy for breakfast. Our approach to COVID has been fractured. It has been a struggle, and it has been piecemealed. And as we know, this pandemic doesn't care about our borders, doesn't care about our cities, our towns, our counties, our rivers, and it will spread when given the opportunity. What you asked earlier is so pointed. The 50% that will avoid healthcare because of the cost speaks so strongly to the need for Medicare for all, for everybody. It cannot be that the most responsible economic choice for individuals and families is to avoid the doctor. We need everyone to be healthy. The same ship together. We are going to sink, or we are going to float together, and we can't do it without healthcare. So it's a pleasure to be here, and I look forward to being a part of this progress.
Thank you very much, Sarah. The next candidate that's going to speak is Mark Newman.
Oh, hi. Excuse me. I'm Mark Newman from 3rd District, Wisconsin, running for Congress, to represent the Western Wisconsin folks in Congress, and a retired physician. So this question has to be addressed fundamentally, that we have a broken system, a patchwork system, an inability to organize ourselves in an effective response. And so our response to the emergency, the public emergency, is a major disaster, unfortunately. And I think the base of the problem needs to be faced, and that is that our healthcare industrial complex is fundamentally oriented towards making profits for those who deliver the services, instead of a healthcare system that is fundamentally oriented towards the advancement of health of all of the people served. And until we face this reality, we're just stuck. Now, the Obamacare ACA was an attempt to put a Band-Aid on this broken system. And for at least 6 times in the last 100 years, we have tried to produce universal health care for our citizens in the United States. But at this point, unless we can recognize that our for-profit system is keeping us from being able to address truly the health needs of our citizenry, we haven't yet hit bottom. And I think that's the issue. Maybe COVID will bring us there. Maybe ultimately we will realize that we need a fundamental intervention, and that this pandemic, this public health emergency, will cause us to finally, as a citizenry, recognize that we are hit bottom and we need help.
Thank you very much, Mark. Next, we're going to hear from Brian Benford. Brian, are you here?
Hi, thank you, everybody. Thank you, OWR, for putting this on. My name is Brian Benford, and I'm running for the Wisconsin State Senate in District 26. But folks, please indulge me. I don't want to participate tonight as a candidate. I'm a 30-year family advocate, and I'm a social worker, and I work for the UW-Madison Odyssey Project. And I want to talk to you from the heart. Part of the question is what's going on the ground. For the last 30 years, I've served the most vulnerable and marginalized people in our community. And I know I'm preaching to the choir here, but it goes without saying that with COVID-19 and for centuries longer systemic racism, the people that I'm serving are just getting hammered. I got a call the other day that I want to share with you, a 27-year-old single woman who has profound mental health issues and no health care. So she's not being treated. She called to tell me that her mother a month ago was diagnosed with COVID-19 and spent close to 3 weeks in the hospital, and at one point almost died. When mom was finally released from the hospital, her workers' comp was denied. She worked at a nursing facility for 20 years, and her and some of her co-workers had all come down with COVID-19, but workman's comp said she could have got it anywhere. So here mom and the daughter both are facing housing insecurity. There's no food resources. There's no medicine. As mom is trying to get unemployment, that fell through. I'm seeing a meteor headed at us, folks, and it's this perfect storm that long before COVID, as the figures you shared, Richard, bear to light, and you had said it in your comments, but long before COVID-19, I've worked with families on many of these issues, but now they're amplified because of this insidious disease. So as I said, I'm happy to be part of this forum, but I wanted to speak from my heart as a social worker more than a political candidate. And sign me up for the pledge. I'll do it right now. I know there's a lot more to go tonight, but I want to tell everyone, and if I'm preaching to the choir, forgive me, but folks are suffering in many different levels, and I'll talk more about that with my next opportunity. Thank you.
Thank you so much, Brian. Next, we're going to hear from Michael Beardsley.
All right. Thank you, everyone. Thank you, Andre and Rich, for putting this on, and OWR and the other candidates. It's awesome that we have so many of us really pushing this in Wisconsin. So what I'll add on top of what everybody else has talked about on this answer already is really, it's just incredibly unfortunate that a pandemic like COVID-19 has really been what has exposed the healthcare system to millions of people all at once. The last speaker just said it was it's been a perfect storm, and it was bound to happen. So what I've been seeing on the ground in this campaign in the 6th district is it's been incredibly supportive of a single payer system for 4+ years now. With the Bernie 2016 presidential run, his ideas are very well received in this area of the Fox Valley and central Wisconsin. But COVID has really pushed the narrative forward where Medicare for All is pretty much at a point where most people agree that it's the end goal of the healthcare system. But what I've really been seeing is different opinions on how we get there, or even how the system's ran. Whether some people think it just needs to be a separate nonprofit entity. Some people want it to be obviously a public government run system. Whatever the case is, people are very much on board and know that it's necessary that we have a single payer system to really solve these issues. Even on the conservative side of people that I've talked to, they're very much on board for Medicare for All. And at first I was pretty shocked. Maybe that's because I had a low bar, but once I really dug into what the issues were and what they were struggling with, it's really clear that people are coming to terms with and noticing that as a nation we have a non-unified approach to tackling COVID, and it's failing miserably. We're the only country that really hasn't been able to figure out how to handle this, and it's because we don't have a unified system. It's everyone kind of it's a free-for-all really, and it's for profit, so it's just a giant mess, and people aren't getting the help they need, and they can't afford it, and all these different issues we're going to talk about more in depth tonight. But that's what I've been seeing. I think it's really encouraging that people are on the same page on how we get there, but there's a lot of work I think we need to do on marketing, messaging, and convincing people of the core idea to really make this happen. I think there's an opportunity with this pandemic. I don't know if opportunity is the right word, but it's really pushed the movement forward. So I think now's the time that we make it happen.
Thank you, Mike.
Thanks, Mike. So I guess I'll take it from here. So I'm gonna just do a quick introduction of myself. Rich already introduced me as Andre Walton, the Southeast Regional Organizer for OWR. And thank you to all the candidates and everyone who's joined us tonight. But I just wanted to make a quick statement about how I feel about Medicare for All. And I do want to start by stating that at the core of our healthcare problems is our broken campaign finance system. I believe until we stop allowing corporations to buy off our politicians, I fear our healthcare system may never be truly fixed. But Dr. Martin Luther King Jr. stated, of all forms of inequality, injustice in healthcare is the most shocking and inhumane. He stated that in 1966, at the height of the civil rights movement. 52 years later, and we're still facing that same inhumane crisis today. We live in a country where your level of income defines your level of healthcare you receive far more than any other country or industrialized nation on the planet. We pride ourselves as having the best healthcare system in the world, yet a study done by the Commonwealth Fund ranks us dead last of 11 industrialized healthcare systems, mainly due to the fact that we're the only country that has a for-profit healthcare system. We have a system more concerned with quarterly profits rather than actual care. As a result, Americans have less annual checkups and declining life expectancies. Rather than go to the doctor for preventative care, people avoid the doctor unless it's an emergency. In the wealthiest nation on earth, we should not have to choose between putting food on the table or paying our healthcare bills. We should strive to ease the burden on American families and fight for a Medicare for All system. And that's what we want to engage today. So I'll go ahead and ask the question for the next candidates. And the question is, the Affordable Care Act was supposed to reduce healthcare spending, cover more people who were uninsured, reduce racial disparities in coverage, prevent people from being locked into their jobs, and through Medicaid expansion, decrease the coverage gap for those making too much to qualify for Medicaid but unable to afford private health insurance. Republicans ended up blocking Medicaid expansion. Do you think the ACA has lived up to its promise? And what do you think the solution is going forward? And the first speaker we have is Mason Becker.
Hey, everybody, and thank you, Andre. That's a great question. My name is Mason Becker. I'm running in the 33rd Assembly District, which includes portions of Jefferson, Walworth, and Waukesha counties. We're basically halfway between Madison and Milwaukee. This is actually a very personal question for me because for about 3 years, my wife and I and our family, we had to purchase our healthcare coverage through healthcare.gov and via the Affordable Care Act. I am a small business owner. I'm part of a small family restaurant business that's been in this area for over 30 years. And so, of course, I don't receive employer-provided healthcare coverage. And my wife, for a time, did not receive it either. Honestly, for 2 years, the first 2 years we were on insurance through the ACA, we spent enough between co-pays and deductibles and premiums to pay for a nice used car. The third year, we literally spent enough to pay for a nice new car. I am not exaggerating. So the ACA, it was a good first step. I admired and agreed with the principles of what it was doing. I do believe healthcare is a right. Everyone should have access to quality and affordable healthcare. And as an employer, I understand that a healthy workforce is a productive workforce, but the ACA has been so undermined by Republicans at the federal and state level. We need to move towards a form of universal health care, whether that's Medicare for all or something else. We can get into that later. But the ACA, it's been so undermined, we can't stick with that. And currently, we still have a system where too many patients are caught between the healthcare provider, the insurance companies, and if you're getting your healthcare through healthcare.gov, the federal government. And trust me from personal experience, that is not a place anyone should have to find themselves. So hope that answers the question.
Thank you, Mason. I really appreciate your answer. Next, we have Emily Voigt.
Hi, everyone. I'm Emily Voigt. I'm running for State Assembly in District 3. It's a really interesting area. It's part of Appleton, part of Menasha, Kimberly, parts of Little Chute, and up along Brillion, and then down along the lake. So it's a very gerrymandered district. But also, like Mason, this is a very personal topic for me as well. My family receives Badger Care. And if you're not familiar with Badger Care, it is our state's Medicaid when you are low income that you receive this. And we've had a lot of issues in our family with the Badger Care, specifically dealing with autism therapy for my son. I spoke about this in the Organized to Win Summit, so I'm sure some of you would probably listen to that, so I don't want to go too far into depth about this. But the short answer is the ACA did not go far enough. It was a great first step, but I think we need more. And we do need something universal healthcare. I'm reading these comments and talking about not wanting to use labels or whatnot, but whether we call it Medicare for all or Medicaid for all or universal healthcare, the point still remains we need government funded insurance and we need something better than what we currently have. And I will tell you this as well as another personal story about receiving Badger Care. While it is excellent for healthcare, it covers so many things. It is horrible for dental care. I have had Marquette students extract my teeth in a free clinic because the clinic that we're supposed to go to when we have Badger Care is so overwhelmed with patients. They can't see people when they need to. You have a hard time getting in for routine cleanings and things of that nature. Also, vision care under Badger Care is lacking as well. You're given very few options for frames and you end up having to pay for it yourself. These frames I got from Walmart. I think Badger Care covered maybe $17 of them, and so I had to come up with the rest of the money. So like I said, for me, this is extremely personal. This is the biggest reason why I am running for office, is because we need a better healthcare system, and we need to accept the Medicaid expansion dollars that are our taxpayer dollars. We paid into the federal government for this. We should be getting our money back and helping more people get on services like Badger Care. Thank you.
Thank you, Emily. Next, we have Joni Swiggum. Is Janie here?
Yep, this is Jane.
Okay. Thank you. Oh, sorry, Jane.
Yeah,
apologize.
plain Jane. So my name is Jane Swiggum, and I am running for State Senate District 32, which is all of Crawford County, which is where I live. It is also La Crosse County, Vernon County, and some really weird stuff going on in southern Monroe County. Lots of gerrymandering up there because there is a large Republican population in the southern portion of Monroe County. So I am a registered nurse, and I have been one for 20 years. I fully believe that ACA had great intentions and has failed us miserably. I see no shame in saying we need single payer healthcare. Whatever label you want to put on it, it is the same thing. We need it, and we must demand it. The thing that is keeping us tied to this horrible system is the big money. You cannot talk about single payer healthcare without getting just absolutely furious at the political re-election particular campaign funding. If we have insurance and big pharma whose prime directive is to make money, and then they are taking their profits and funneling them into our elected officials' campaign coffers, they are buying the people that we elect. You cannot talk about changing this without trying to get the greedy fingers of big pharma and insurance out of our elected officials' pockets. So how do you do that? You have to roust people out of office. We have got to become extremely active in this process. So I feel that we cannot succeed without removing the campaign finance aspect from our system. And I am so committed to this that I am running without taking any money from any source, which is extremely difficult. I cannot get traction because of that. So we have to start voting for candidates who will stand up and say, I will not take money and I will agree to term limits. Without those two things, I feel it is impossible for us to get any further with single payer healthcare. The influence of big money is ruining healthcare for people. And until people really start to stand up and say, this is wrong, we're stuck. So we, as people running for office, are the people who are going to have to try to make a big change in the paradigm in order to fix this for everybody. Thank you.
Thank you, Jane. I really appreciate it. Our next speaker is Joni Anderson.
Okay. My name is Joni Anderson, and I'm running for Senate 14, and that includes about 10 counties. Green Lake is the only full county. Otherwise, there's a little bit of Washera, a little bit of Sauk, part of Adams, part of Columbia, part of Marquette. I mean, it's just a lot of gerrymandering. I just want to tell one quick personal story about the Affordable Care Act. I have a good friend who has MS, and she had after she had to quit her job because of it. She was part of her insurance came from the Affordable Care Act, and she had a pretty good insurance. She thought she was okay. She didn't have big problems with it, so she re-signed up for it. And this was about 4 or 5 years ago. And after the first of the year, she went to pick up her MS medicine. And some of this medicine is really, really expensive. And she had to leave her medicine behind because she didn't have a $5,000 copay. Same insurance company that she had the year before. So she left her medicine behind. In the next couple months, all of her friends watched her go through withdrawal symptoms. Very painful, until her doctor finally was able to get her a grant so that she could get on her medicine again. These are some of the issues that people face, you know, when they have the Affordable Care Act, and it doesn't go far enough. It never did. And to punish people for not being able to afford insurance, that was really wrong to begin with. So I think we really, I think term limits would be a good idea. Michigan does have 6-year term limits. And it would help keep the money out of the politicians' pockets, especially since some of them that we have right now, that's how they make their, that's why they won't sign on to a single payer or universal health care act. But we also need to raise the minimum wage because that's how we pay for it.
Thank you, Joni. I'm going to pass it back to Richard.
Thank you, Andre, and thank you, candidates. For over half a century, the United States has tied health insurance to employment status. Following this pandemic, as we talked about before, it's left millions unemployed, scrambling to find health insurance plans, many of them unaffordable, while remaining ineligible for state health programs like Badger Care or Medicaid. Should the U.S. still tie health insurance to employment status? And the first speaker will be Ed Vogt.
Hi, everybody. I'm Ed Vogt. I am running for state senate in District 12 in northern Wisconsin, which is about 9 counties, a very large area. And I'm coming at this question from that perspective and from the perspective of a lot of the things that we have to convince here have to do with the money interests that hold the power right now. So from my perspective, we have to know where this program originated from to begin with. So the way we have it set up now, it was first offered as an employee incentive to offset wage freezes during World War II. And it had a tightly constrained labor market at the time. So health insurance benefits became a way to attract and retain people as talent. However, as insurance expanded to cover more services and medical inflation grew, employers shifted the rising costs onto their employees. And that has resulted in this erosion over time of the value that we get from that. And it leaves employers open to blame from employees feeling the financial squeeze. And still a lot of people assume that their private insurance that they get from their employer is the best that they can do right now. And that's an employment-based trap. And Americans in jobs they would otherwise leave stay in those jobs because they're trapped to their job because of insurance. That's a job lock. And that causes stagnation and workforce immobility that really hampers employee engagement and blocks them from self-employment. It blocks them from entrepreneurship because self-employment and entrepreneurship actually rise in countries that have access to insurance outside of their jobs. So COVID-19 has really laid bare the problem with insurance, the system that we have now, and it leaves people really economically vulnerable when they're at a point that they're least able to absorb the costs and more likely to need the care. So untethered from stable employment, millions of Americans are desperate for a new way to access their insurance. And many businesses have nothing to offer right now. So employers could also benefit, and they could be absolved of the burden of choosing health insurance plans for their employees, and they could actually focus on what they do and get back on their feet in the wake of COVID-19. So small businesses that are struggling greatly.
I gotta cut you off there. We got a time limit.
Oh, sorry, I missed it, guys.
No, you're good. I just asked that all candidates pay attention to the chat because our moderator Charlie is giving you a warning sign. Just be aware of that. Thank you.
Okay. Thank you very much, Ed, though, for your comments, for your discussion points. I appreciated it. The next candidate, again, is Michael Beardsley.
All right, thanks again. And real quick, I realized I didn't introduce myself the first question. So I'm Michael Beardsley. I'm in Oshkosh, Wisconsin, running for Congress in the 6th District, which real quick includes Columbia County, Fond du Lac County, Green Lake County, Marquette County, Waushara, Ozaukee, Sheboygan, Manitowoc, and then parts of Dodge, Milwaukee, and Winnebago County. So it's a big area in the Fox Valley, middle of the state. But so I do have a lot to say about this topic, so I might fly through this a little bit. But this is one I talk about a lot when I'm campaigning. I think it's ridiculous that, and it never made sense to me why we're the only country to primarily tie health insurance to employment. It made zero sense to me before this pandemic, and it makes way less sense now. And we're seeing the issues with it. And we don't do this for any other insurance. So like Ed mentioned, this is kind of a byproduct of a new deal that's kind of come back to really hurt us, especially with millions of people being kicked off their health care. They're losing their access to health insurance, and they're still in the middle of pandemic. So they're slapped with options like COBRA or Obamacare, which we touched on in the previous question, is really just, both are just not good enough. Just my honest opinion on COBRA, I think it's a slap in the face. Pretty much the sequence is you lose your employment, you lose your insurance likely at the end of the month whenever you get let go, and then you have the option to pay over $1,000 a month or more for insurance that really doesn't do much. So just no thanks on that whole system all around. I think it's just awful. And then real quick, looking on the business side of things, I'll focus on this a little bit. I think it's a ridiculous amount of overhead and administrative costs to put on business owners to provide healthcare for their employers. It doesn't make sense to me why we're putting that burden on businesses. Like Ed touched on a little bit just before me as well, is we need a system that's, one, more simple and gives people the freedom to pick whatever career they want and not worry about losing their health insurance. To me, it's so simple, yet it's something that we haven't been able to break free from. So I think it's a big fat no that it should not be tied to insurance or tied to employment. So thank you.
Okay. Time's up. Thank you, Michael. We're going to have Emily Voigt speak again.
Hi again. Well, one thing I think we haven't even touched on is insurance based on employment doesn't necessarily mean that the insurance is good. Just because you have a job and it offers you insurance doesn't mean you're going to be getting good insurance, or even that you're going to be getting reasonably priced insurance. When I was working for J.J. Keller, I remember for my family at that time, there was only 3 of us, my now ex-husband, my daughter, and myself. I was paying about $300 a paycheck. My premiums were very high. We had co-pays. We could go to the doctor, but we had to plan surgery around when, because I was having surgery one year, and we had to decide, we had to have it at the very end of December because we needed to make sure we had met our deductible so that the insurance would cover 80% of a very much needed surgery for myself. So why are we even discussing about insurance being tied to employment when most insurance, sorry, I'm having a moment. When most employment doesn't offer good insurance to begin with. And then when we look at other jobs like teaching, which used to offer the top of the line insurance, and we now have no collective bargaining for our teachers, they're getting screwed, frankly, on their best benefit, which was insurance. So short answer, no, we should not have to worry about employment, insurance being tied to employment. Because like I said, just because you have a job doesn't mean that the job is going to offer you decent insurance at all. So that's it.
Great, thank you. Thank you, Emily. Next, we're going to hear from, is it Ali Marsh or?
It's Ali Marsh. It's not intuitive.
Oh, thank you.
Thank you. Well, thank you, Rich. Thank you, Andre, for hosting this event. So yeah, hi, everybody. My name is Ali Marsh, and I'm running to represent the 76th Assembly District here in Madison. And one of my top reasons for running is improving the mental health of our residents. And when we talk about improving mental health, we have to talk about increasing access to healthcare. So that is certainly one reason why I support no longer tying health insurance to employment status. I'd also like to share a personal story on this. So earlier this year, I was hired as a contractor to do communications work for a nonprofit. And I was on, and actually currently still am, a health insurance plan from the federal marketplace, and with a ridiculously high deductible. And I'm fortunate I don't have to go to the doctor all too much in pretty good physical health, but I do live with mental health conditions. I live with both anxiety and depression. I try to speak openly about this because I believe we must destigmatize mental health. and was recently struggling with my depression and emailed my doctor to have her prescribe antidepressants. And so went to the pharmacy to pick up the medication. And as they were handing me the bag, they said the total is $300. And I was just stunned. And they said, okay, we'll give you a $200 coupon, but still the price was $100 a month for this medication. And previously I'd only paid $7 when I had full good insurance coverage from an employer. And I walked out of that pharmacy without the medication. I was just fuming with anger, not only for myself, because I know my situation pales in comparison, compared to other people, but for the system as a whole, where we are asking Americans to forego treatment and medication because of cost. And we cannot accept this. And that's why I fully support, again, no longer tying health insurance to employment and more broadly supporting Medicare for all. So really appreciate this question, and thank you.
Thank you for your answer, Ellie. We're going to hear next from Jane Swiggum again.
No, insurance should not be tied to your employer. But I would like to go a little bit further, because I think the idea of insurance being equated with healthcare is wrong. Insurance is nothing but a pay source. And the insurance companies want to make money. So, like you were saying with your medications, they will make a medication a tier 3 instead of a tier 1 in a way to manipulate your ability to get health care from what your doctor or provider is prescribing. They do the same thing with tests. As a nurse, I sit in the clinic all day long and I help people navigate trying to get a tier 1 drug so they can afford it, trying to get able to get the tests that they require. I had a lady in her 50s, morbidly obese, diabetic, chest pain when she'd climb the stairs, and the insurance company said she did not meet their criteria for the nuclear cardiac ultrasound. So I think that, first of all, you need to change your mindset. Insurance is not healthcare. And if you have received good healthcare, it is not because of your insurance, it is in spite of it. And we need to change that mindset. Now we need to take this away from our businesses. Businesses should have no business supplying healthcare to people. And until people start to recognize what a money-hungry business this is, we're stuck. So we need to teach people, we need to encourage them to participate, we need people realizing that their medications are being manipulated price-wise in the US where it's not in other countries. So let's take this all away from the businesses. Let's talk about a single payer where the government is responsible as the payer source to get us healthcare.
Okay, Jane, thank you very much for your response. Next, we're going to hear from Sarah Yakub again.
Hi, so as not to be duplicative, I will keep this to 2 reasons why my answer is no, this should not be tied to employment. Number one, how often do we see people losing employment as a function of addiction, which we know is a healthcare issue, and mental health? And so what we have are people who need healthcare more than ever, and now they're frozen out of it. Second issue, with the Supreme Court decision that just came out this month, we now have employers making decisions that put themselves between individuals, primarily women, and their doctors, and that is inexcusable. How many employers take the time, for example, to figure out that birth control is prescribed for a whole host of reasons that have nothing to do with preventing pregnancy? And even presupposing they know that, are we going to trust them to put their idealism second to the needs of their employees? And anyone who says that an employee can just go get a job somewhere else is completely out of touch and doesn't get it, is not realistic. So absolutely no, we should not have healthcare tied to employment. Thank you.
Thank you, Sarah. Next, we're going to hear from Dan Sherrill.
Hello, my name is Dan Sherrill. I'm running for District 55 here in Neenah, town of town of Clayton and very gerrymandered district also. And the reason I'm going to talk about it is because I worked 43 years in a factory setting, and I was part of the negotiation process also of our insurance. And it turned out to be a really big cluster at the end where our deductibles were so high, out of pocket was $7,000. And I'm working in a factory, and these people are not making that kind of money to pay that kind of. And so we need a system that's going to work for everybody. I was paying the same premiums, the same deductibles as the CEO of that company. Well, he can much more afford that than somebody working on the floor. So we need to change that, where we need health care for all, obviously. I don't see it happening at the federal level, and I think we need to take that expansion for Medicaid and Medicare, and let's get it for everybody. I think we should expand it, Badger Care, for everyone in the state of Wisconsin, so everyone would have the same insurance. Also, there's many small businesses in my district here, and those businesses cannot afford to offer health care. So where do those people get their health care? Theirs coming out of their own pocket. So we need to make some major changes to have affordable health care for everybody. Most people can't afford $7,000 out of deductibles. So thank you for putting this on. I think we need to change it, and it will change. Thank you.
Thanks, Dan. I'm going to turn it over back to Andre.
Thank you, Charlie. Sorry, I was having problems with my sound there. All right, so we're going to go to the next question. Do you think union organization of workers in healthcare to be a good thing or a bad thing? After Act 10, quasi-public corporations, notably the UW health system, declared themselves public bodies under Act 10 and stopped recognizing their unions. Can you comment on this and the issue of nurses organizing in the state following Act 10? Our first question for this is Joni Anderson. Joni, you're still there?
It says I am, but it said you turned me off, so.
All right, it looks like you're good to go then.
Because I can't see anything.
Oh, well, Joni, we can see you.
Yeah, we can see you, Joni.
Okay.
We can hear you.
Okay, so my background is with labor. And I do absolutely feel that the nurses and other healthcare officials should have a right to be union, because I mean, it provides a voice in the workplace. I did talk to last year, I talked to a nurse that came to the OWR convention from UW-Madison, and they were in the process of attempting to reorganize and be recognized at that time, and it's been my understanding that they were not recognized. But one of the issues that came up was safety, and nurses and other healthcare officials, when they're working on the front lines like this, they need to be able to be upfront about what they need for safety in the workplace, because they're always right there fighting for their PPE. And I actually walked with some nurses up in Minnesota, and when they were on strike, and one of the reasons they went on strike was because of health care. The hospital up there wanted them to agree to health insurance that the first year it would pay 80-20. Next year it would pay 75-25. Following year 70-30. So it was just going to get worse from year to year. National Nurses United is one of the strongest organizations across the country, but one of the loudest voices for Medicare for all, everybody in, nobody out. And if our nurses were recognized as union employees across the state, rather than having to fight for their voices, we'd have a much stronger voice in Wisconsin behind us, because they just are always working to make this a reality.
Hey, Joni,
Thank you,
thank you very
Joni.
much for your response.
Thanks, Joni. I appreciate it. Our next guest or our next speaker will be Rob Slamka.
Hi, everybody. Thank you, OWR, Richard McGowan, and Andre Walton for hosting, and thank you everyone else for attending. I do appreciate it. I'm a candidate in the 78th District on Madison Southwest side. I have a history in organized labor. I was a sheet metal worker, a union sheet metal worker for 32 years. And to the question, I absolutely do believe that anyone who wants a union should absolutely have one, whether it's union or whether it's a representative body that they create amongst themselves, which is a very difficult thing to do. Had a conversation with Richard about this very issue. He said it's a tough one for people to handle. I'm ready for it. I got a chance to watch what was going on when Scott Walker took public sector workers to the woodshed with removal of collective bargaining. And I recognized how he did it. He used leverage that he had politically with even organized labor to work against them, sadly. So the bigger issue is these individuals are now in a situation, the university nurses, where they're trying to get representation acknowledged by the administrators at that facility, and they're being told that they can't be represented. And the thing that I don't understand is the National Labor Relations Board, Section 7, states that a worker has a right, an inalienable right, under statute of federal law, and we lost that here in the state of Wisconsin. So the balance of the time I've got here, I know that it's something that we absolutely have to secure for these people. Someone earlier had spoke to what happened to the teachers and their exceptional health care being removed. It's the same thing for the nurses, and it's the same thing for the providers having to deal with these shortcomings now because of that law. We have to do something about it, and we will. Thank you very much.
Thank you, Rob. I'm going to pass it back to Charlie.
So the next question is, both the U.S. House and Senate have legislation introduced that would implement a Medicare for all single-payer system. Do you support it? If so, how do you see Wisconsin elected officials helping to lead its passage? Do you think most Democrats are in support of this right now? If not, what is preventing them from supporting it? What do you say in response to those who say Medicare for all is unrealistic, too idealistic, or socialist? And first up is Mark Newman.
Thank you for the question, Rich. You know what? We do have two bills in the Congress, one in the Senate and one in the House, H.R. 1384 in the House and 1129 in the Senate. These are real pieces of legislation. These are single-payer, universal comprehensive healthcare delivery systems. They're reflective of what Canadians have, and this is legislation that could go forward. Many people act like we don't know how we could do this. We have a model, we have good legislation. You ask whether or not most Democrats are supportive. Well, certainly my representative in the 3rd District has not shown any support, and it's one of the reasons that I'm running this campaign to meet him at the primary, because when I talk to people, I find over and over how much everyone is in need of solving this problem. And so I wonder if our Democratic representatives are in favor, like their constituents are, but they're afraid to do anything about it because of the way they have to pay for their campaign finance their campaigns. And so I don't really know where they stand. I know that Mark Pocan is a supporter, and so is our Senator Tammy Baldwin. And when it goes to calling it unrealistic and socialist and so forth, those are just words that people throw out there. Sticks and stones will break my bones, but words will never hurt me. But this is just part of the propaganda campaign, and they're false because other countries have solved this. It is doable, and that's just the for-profit interests that are trying to fog our conversation and make us afraid to move forward and do what we need to do. Thank you.
Great, thanks, Mark. Next is Ed Voigt. Ed, are you still here?
Yeah, sorry about that, guys. I'm winning tonight. I'm going to keep this one shorter too. But yes, absolutely, I support this. Do you like paying premiums? You know, the system as we have it right now places America's health system on an island unto itself, away from its peers on a global stage. You know, the United States, I think Andre said 11 industrialized nations, but it ranks last on measures of quality, efficiency, access to care, equity, the ability to lead long, healthy, and productive lives for the citizens. You know, compared to other major industrialized countries like Australia that have solved this problem already, Canada, Germany, the Netherlands, New Zealand, the United Kingdom. So the proof is in the pudding. And why isn't the Democratic Party of Wisconsin particularly getting behind this? Because of donors, because they have a wealth of interest in order to fund their campaigns for re-election through the healthcare industry that holds sway over our politicians. And the way forward in regards to that is, I believe that the political winds are blowing in this direction. I believe that COVID has again laid bare the necessity for this right now. And I believe with enough pressure, they will feel those prevailing winds and they will make the necessary changes in their message in order to make sure that the people of Wisconsin get insured, and that we expand it, if not on a federal basis, because our federal government, as we see right now, isn't exactly functioning. We have to take this on with Badger Care in the state of Wisconsin itself and implement it here. And I believe that we can do that. I believe that we can create that pressure. I believe that, I mean, this forum has over 100 people in it right now, and there is resounding, you know, pressure to be put on. So thank you.
Thank you, Ed. Dan Sherrill is up next.
Where am I? See me?
Yep, we can see you, Dan, and hear you.
I don't see me. All right, I'll just go for it. I support Medicare for all just for the simple fact that we need a system that everybody has the same insurance. We have a for-profit healthcare now that's not working for us. As far as the people I talk to, and it's Democrats or Republicans, everybody supports healthcare for all.
Dan, we did lose your video. Yeah, I think you turned it off after you asked if you want to put it back on.
All right, let me see. See me?
Nope.
No, I ain't seeing it either. Oh, I see it.
There you
Sorry.
are.
Okay, sorry. Anyway, Medicare for all should just be automatic, because we have a healthcare that's for profit, and when we have a profit, who's making the money? And we follow the money, because we need insurance that works for everybody in this country. When I talk to people, there's people out there that don't have any health care, and I tell them, you need to get health care, at least it's catastrophic. And they tell me, I can't afford that. Well, you know what? If you get sick, that's going to be on you for the rest of your life. It's going to follow you forever. We need people that support this. So we have a Republican system and a Democratic system, and I don't think either party is supportive of Medicare for all, and we need to change that. There's too much money involved in it, and United to Amend is something that we need to get the big money out of politics. Money in politics controls everything we have and is run right now. So that's where I stand on it. We need it for all.
Great. Thanks, Dan. And last for this question is Joni Anderson.
Okay. I just want to say that, you know, as a union member for all these years, I served on what they call the UE Western Regional Board, and I was a delegate to our national convention a number of times. And there I heard so many stories about people that had lived in other countries, Australia, Sweden, you know, and they all said they came to the United States and were just amazed at the difference and how much more they had to pay. I worked with an individual that lived in Canada for a lot of his life, and he just couldn't believe how much money he had to pay out of his pocket compared to Canada. And I absolutely believe that we need a really strong universal healthcare system, one that when the power and the money starts to put pressure on the foundation, that it can't crack. And the only way we can do that is if we have Medicare for all, everybody in, nobody out, so that the power is left more on the outside. So.
Thank you, Joni. I'm going to turn it back over to Andre for the next question.
All right, thank you, Rich. So the next question is, much of Wisconsin is rural. Hospital and low density areas have been struggling for years. The Charter Center for Rural Health released a report in February 2020 cautioning that 12 hospitals in rural areas are at risk of closure in the near future. If you are running in the rural area of the state, has this issue impacted your area? Does this inform your decision to support or oppose Medicare for all? And our first speaker is Michael Beardsley.
All right, thank you. And I like this question because I think the rural areas are a little bit ignored sometimes. And my district is very rural. There's some cities like Oshkosh, Sheboygan, but again, those aren't even really that big of cities. So there's a lot of focus on this, especially when I'm talking to voters on what Medicare for all can do for these rural voters. So this is something that has set me apart in this race. No other candidate supports anything close to Medicare for all. Which is really one of the reasons I jumped in the race as well, because people want to not worry about how and where they're able to get their healthcare. And if we continue with the current system we have, this is just going to keep putting this massive burden on people, but also these hospitals that are expected to raise money to really stay afloat, taking the focus away from what it should be, which is on the people. So like I said, the for-profit industry that is healthcare as a whole right now is what's driving these rural hospitals out of business, which is pushing the costs on the people where they either can't afford to go to the doctor, so they don't even go at all, or they can't afford transportation or have transportation to get to a hospital that's further away because their closer one closed down. So in this process, hospitals and people are losing, and the only people really are winning are the health insurance providers. So so as long as we're running this healthcare for-profit system, we're going to continue to see these struggles in rural areas because those are always the first to go. That's just how it is. If a hospital network has struggling hospitals in rural and urban areas, they're going to close the rural ones first, just by the nature of demand in the market, which is not how it should be, but that's the current system we have up. So to wrap, people, from what I've been hearing, very strongly just want their human right of healthcare no matter where they are. And Medicare for all is really the only solution that shifts the focus back from the focus and priorities back on caring for people, and therefore allowing these rural hospitals to serve people instead of putting their focus on raising money to stay open. So we really need that transformational shift, and I think Medicare for all is the only way to do that. So thank you.
Thanks, Mike. Appreciate your answer. Next up, we have Emily Voigt.
Hi again. So my district is partially, I wouldn't call it urban because Appleton I wouldn't consider an urban center since we're only 75,000 people, but a big portion of it is rural. And when I look at the maps recently to see how many healthcare providers there are in the district, it's shockingly low. And there are 0 hospitals in my district. Now, there are hospitals outside of the district that are very close, but it still shows when you get to the more rural areas of Wisconsin, you may not have the option to go to a hospital. So we're putting undue stress and burden onto the hospitals that are in the more urban areas by not having hospitals in the rural areas. And this is going to be even more and more of an issue as we go along with COVID and more people not masking and taking care of themselves and then ending up in the hospital. So I think, I mean, for me, Medicare for all has never been even a question. I've always felt like healthcare was a human right and should be a human right. But when we are talking about, like everyone else has said on this call tonight, the stress, the burden, and as Jane said, you know, health insurance is not health care. And I'm glad that she made that extremely important distinction. We need to look at those things as well when we're talking about our rural areas of Wisconsin. And as Michael Beardsley said too, a lot of the rural areas tend to get overlooked because not as many people live there, you know, so, but we shouldn't be ignoring rural areas of Wisconsin as well. So yes, we definitely need Medicare for all. Thank you.
Thank you, Emily. I really appreciate your insight on that. Next up, we have Jane Swiggum.
Hello again. So I am a nurse, and I keep saying that, but it's kind of why I'm doing this. And I live in super rural Gays Mills, Wisconsin. We, in my area, specifically, we have 3 tertiary access hospitals, which means you go there, and if you're really sick, you get transferred to a larger hospital. These hospitals, such as now called Gunderson Boscobel, Vernon Memorial, Crossing Rivers and Perdasheen, Hillsborough has a St. Joseph's, and I think it's now Gunderson St. Joseph's. What we are seeing is these small hospitals are unable to get reimbursement because the majority of their patients are Medicare and Medicaid patients. The reason why I know about all this is because I was a utilization review nurse. And what I did is I reviewed charts at hospitals for Medicare and private insurance to make sure that patients met the criteria to be admitted to the hospital and met the criteria to stay there. What people don't know is that Medicare and Medicaid pay pennies on the dollar for what healthcare actually costs these hospitals to provide. So you have a hospital, let's say the bill would be $10,000. Medicare and Medicaid have not renegotiated their reimbursement rates in years. So these hospitals that are taking care of these people are actually losing money when they take care of these people because they don't get the reimbursement. And the one concern most people have when we talk about Medicare for all is that it does not pay for the cost of healthcare. So these hospitals are going broke. And if they are very fortunate, a larger hospital system will pick them up and umbrella them under their name. So Gunderson Boscobel, Gunderson, Hillsborough, I think it's St. Joseph's Hospital. So they get that. These hospitals that are bigger and have far more private insurance carriers or patients have more money. So they can pull them in underneath them. And they do realize, these bigger hospitals, that these smaller hospitals are imperative for care in rural areas. So what do we need? If we're going to do this and we want to keep these small hospitals rolling, which we all do, I was born.
I apologize, Jane. We have the time limit, but I'm going to pass it back to Rich.
Thanks, Andre, and thanks, Jane. The next question is as follows. Racial health disparities are very troubling. I apologize, I'm having some difficulties. Racial health disparities are very troubling and a significant public health problem in this country. African American, Latinx, and Native American patients are at significantly higher risk of having a chronic disease. They are subject to higher rates of polysubstance and alcohol use disorders, and less likely to receive treatment for these conditions. They remain at higher risk of death from gun violence. They're at much higher risk of being uninsured or underinsured. Moreover, the COVID pandemic has disproportionately hurt communities of color, causing higher rates of death and hospitalization. Do you see Medicare for All helping to reduce these disparities? And if so, how will you advance the movement for Medicare for All within the broader fight against structural racism in this country? And first up is Brian Benford.
Thanks again, Richard. I really appreciate that question. So with the first question that I answered, I had mentioned that, yes, I'm a political candidate for state senate for the 26th office, but I can't escape the reality that I'm on the front lines right now. So with that question, I think about here in Dane County that 12% of Black and brown people, but 22% of the positive cases and 44% of the hospitalizations. And when I think about systemic racism and COVID-19, and I said it before and not to sound cavalier, and once again, I know I'm preaching to the choir here, is that these two insidious diseases have ripped apart the fabric of our worlds. They've torn apart the world as we know it. And as I really come to believe that for us to get out of COVID-19, I know we have medical professionals in on this event, but for me, I truly believe that we really have to deal with this through the best science and through medicine. So Medicare for all is absolutely the first step. Universal health care is absolutely the first step, that as we navigate out of this really uncertain disease in these uncertain times. But as we go back to systemic racism, it's all weaved together. Everything is weaved together. So when we think about health disparities, incarceration disparities, housing disparities, food insecurities, the list goes on. They're all weaved together. But on a real practical purpose, right now in the immediacy, we really do have to look at Medicare for all to get us out of COVID-19 and set us on a path to a brighter future.
Brian, thank you very much for that response. Next, we're going to have Ellie Marsh back.
All right, great. Well, yes, absolutely, to answer this question. And, you know, I am probably not alone here in being really saddened by the news of the passing of Representative John Lewis last night. And I actually want to start this question, or answering this question, by sharing a quote that he made in 2009 when he spoke on the floor of the U.S. House of Representatives. He said this about healthcare reform. He said, "We must make healthcare a right and not a privilege. People are dying without healthcare. This week we say no more. People are losing their homes because they are without health insurance. This week we say no more. The American people cannot wait a moment longer." Again, this was in 2009, and the Affordable Care Act shortly passed in the following spring, and it certainly has helped. But 10 years later, as we're living in the midst of a pandemic that is devastating communities of color throughout the country, everything that was mentioned in the beginning of this question, you know, I believe we must say no more. Again, this is the time, you know, to address systemic racism. We have so much work to do with housing, education, criminal legal system. And again, that list goes on, but certainly healthcare is pivotal to this. And so I think Medicare for all is absolutely the way to address this from the healthcare perspective. And as far as how I would advance this movement as a state legislator, I would certainly fight to expand the Medicaid program, Badger Care Plus, and would also, you know, like to see this as a public health insurance option for all Wisconsinites. And then in addition to that, this was actually mentioned earlier tonight, the need to effectively communicate to members of our own party of why Medicare for all is so critical to addressing racial health disparities. So I would certainly focus on those efforts and work alongside community members who have been directly impacted by racial health disparities to share their story to other lawmakers and other Wisconsinites that we need immediate action on this issue. So again, really appreciate this question. And my time is up.
Thank you, Allie. Mark Newman, you're up next.
Yes. So Ollie, thank you so much for that quote from John Lewis. What the Accountable Care Act did is it allowed us to realize that we all have the right to health care. That it was a huge step forward. But the system as it's designed delivers care for profit and individually, one at a time. And we have to recognize that a fundamental issue about our human health is that we do not stay healthy alone. We don't get sick alone. When one of us falls ill, we're in a network of a relationship and we all suffer together. And the same thing, in order to be a healthy human being, we need to live in healthy human communities. So the way our system orients its care to procedures and individual interventions, it's highly unable to recognize this fundamental issue of how we human beings remain healthy and pursue our health together. That being the case, we can decide to have a universal single-payer system that orients itself not to making profits, but to promoting health, because we would be financing it with global finance procedures instead of individual fee-for-service. That being the case, we need to change. Thanks.
Thanks, Mark. Next, we're going to hear from Aisha Mo.
In response to this question, racial disparities exist in every aspect of society because of the complacency of our community with white supremacy. And the field of medicine and healthcare are no exception. And we start by taking an actively anti-racist stance and dismantling the systems of oppression that exist. Inside of healthcare and medicine, that starts by recognizing that all people do not have the access to the same amount of care. Different health insurance plans have access to different providers and different coverages of medications that are completely based on the individual healthcare companies' bottom line, and not based on the best medical practices for individuals and their families. Medicare for All puts control over your individual healthcare plan for you. In addition to setting up a standard of healthcare for everyone, we battle structural racism through magnifying the voices of those who've been speaking and advocating for their communities. Communities of color have been asking for resources and equal opportunities for a while, and we just need to magnify those voices. Look, we know that there is a problem. We don't need another study or more data. What we need right now is to take action to actually help these communities. Thank you.
Thank you, Aisha. And I just want to say, I'm going to hand it back over to Andre. The next question, there's only one respondent, and it's Aisha again. So Aisha, if you wouldn't mind introducing yourself and the seat you're running for, because we skipped that this time. Okay?
Of course.
Go ahead, Andre's going to take over and ask the question.
Yeah, 1 second. I'll ask the question. So Black women in Wisconsin are 5 times more likely to die from pregnancy-related causes than white women, even worse than the U.S. rate of Black women being 3 to 4 times more likely to die. The U.S. already has the worst national pregnancy-related mortality rate in the industrialized world. Suggestions about why this points to disparities in income, health insurance rates, pre-existing medical conditions in the community, and also the way our society values the lives of Black women. What do you think can be done about the implicit racist practices within the medical field that contribute to these disparities? And what about the other social determinants that have led us to where we are now? And Aisha again, and introduce yourself.
As Rich mentioned, my name is Aisha Mo. I am running for state senate in the 26th Senate District here on the west side of Madison, south side of Madison, and basically the Isthmus. This question is extremely important, and I want to start by recognizing I am not a Black woman, and I am not someone who has ever been pregnant, but this is an issue that affects all of us because it affects the health and the lives of members of our community. And I might not have all of the right answers, but I am willing to participate in a conversation for making this move forward. The history of the practice and study of medicine has often focused on men and white communities. As a result, the treatment of individuals is largely skewed to be disadvantageous for Black women. The fact that Black women are 5 times more likely to die of pregnancy-related issues than white women is unacceptable. And even today, expressions of Blackness inside of mental health treatment are reacted to with increased restraints and safety precautions. The question itself hit it on the head on why this might be so. disparities in income, health insurance rates, pre-existing medical conditions in the community, and most importantly, the fact that our society has devalued the lives of Black women. All of this contributes to the horrifying loss of life, and we especially see this when Black mothers are blamed for the high infant mortality rates of Black babies, instead of as a community and as a health care system taking responsibility for the fact that this high infant mortality rate exists. This rhetoric is dangerous. In regards to addressing the issues and creating a solution, what we need to be doing is making sure that we have Black individuals trained in the medical field. We need Black medical students and nursing school students. We need people trained in OT and PT and being PAs. And we need to be making sure that we're providing funding and the resources
Thank you,
in every
Aisha.
aspect.
Sorry, the time's up, but
Of course.
yeah, we really appreciate your answer there. I'm gonna pass it back to Rich for the next question.
Thanks, Andre. So for the next question, the opioid epidemic has been a major issue in Wisconsin, and public health measures here have been taken to decrease fatal overdoses here with some success. While the majority of the opioid-related deaths have been white people, among those deaths, Black people have had higher rates, according to the Kaiser Family Foundation. And despite being a significantly lower percent of the population, these rates are pretty troubling. As one example, substance use disorders and overdoses have long been an issue in minority communities, going back decades, but seem to only get seriously addressed when significant numbers in the white population are affected. In fact, the response to these crises in communities of color has disproportionately been via law enforcement and mass incarceration more than public health measures. What can be done so that our society, including our healthcare system, values the lives of Black people and other minority communities, including Native Americans and the Latinx community, and addresses significant public health issues like, but not limited to, the opioid crisis equitably? And I'm going to change the order around a little bit because we had some people that didn't show up. Let's hear from Ed Voigt first.
Sure. So I'm speaking from the perspective of somebody that lives on the Lac du Flambeau Native American Reservation. So I'm talking about my friends, and they all have healthcare in Lac du Flambeau. So this is kind of a different situation, because over the last 10 years, 6 in 10 babies at this point are born on the reservation addicted to opioids. They are the number 2, Vilas County is the number 2 spot in Wisconsin for opioid addiction, and they have full health care with IHS, Indian Health Services. So the solution that the tribe has put forward themselves is to actively sue the pharmaceutical companies, essentially to cut off the head of the snake, as they say. The crimes that are committed overwhelmingly are in support of the addiction. So in order to get off the top of the list, they're going after pharma, and they want them to pay their share and stop what they're doing, which is stopping the supply. So there's 2,000 people in Lac du Flambeau, and there's 400 drug-related cases by the tribal police a year. So the real victims are the people that are being deliberately targeted by drug manufacturers and distributors in America. The addiction is the result of corporations profiting billions of dollars with reckless disregard for the consequences to the tribe. And I think the company should pay for it. I think the resources should be shifted to cessation first in order to mitigate crime offenses. And I think that they should be going after the pharmaceutical companies.
Great, Ed. Awesome, thanks. I'd like to hear, I believe Aisha Mo is up again.
When it comes to addiction, people of color often get incarcerated, not treatment. What we need to do in regards to resolving this issue is making sure that there is access to treatment, as well as a healthcare plan that covers treatment so that money isn't a barrier. We also need to be able to decriminalize addiction and not just lock people up for having, without receiving addiction treatment. The programs that have been created to decrease fatalities and overdoses need to also be accessible and have a healthcare system that provides access to those programs. Thank you.
Thank you, Aisha. So next, we're going to go through a series of questions. That kind of concludes the forum discussion points, but we're going to go through a series of questions that kind of touch on the candidate's commitment to advancing the cause for single payer or Medicare for all throughout the state of Wisconsin, regardless if they have the ability to really directly legislate it. And so there's 3 different questions, and what we'll do is Andre and I are going to alternate asking the question, and then we'll go through every candidate that's here in the forum, and we'll just look for a yes/no response to the question. And if you have a remark, you just keep it very brief, just a few words. We're not looking for people to expound a lot on the reasons for the yes or no, because you mostly covered those reasons during the forum. So I'm going to let Andre start, and thank you.
Thank you, Rich. So the first question is, will you support single-payer, publicly funded, privately delivered healthcare on federal level, such as the Medicare for All bill in 2019? If so, would you sign a pledge affirming your commitment to single-payer? Answer both questions, yes or no, or yes, 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 no, or no, no. And the first is for Joni Anderson. Joni, are you still there?
There, Joni. If Joni's not available, we can go on.
No, I'm here. I just
Okay.
forgot to unmute myself.
Well, it's okay.
Yes, yes, it's something absolutely as candidates, we not only need to commit by signing a pledge and speaking out, but we also need to be asking the people that are in office now to be doing that.
Thank you, Joni. Michael Beardsley.
Yes and yes. I think with our Wisconsin Revolution and even the national organization, we should be pushing this on incumbents and other candidates. So I would love to sign it.
Thank you, Mike. Mason Becker.
Yep, sorry about that, but yes, absolutely. We do need to move towards single-payer healthcare, and I would absolutely sign on to that.
Thank you, Mason. Brian Binford.
There we go.
Oh, there you go.
There we go. Sorry about that. So to both questions, a resounding heck yes. And I'll advocate for it. Not only will I sign on to a pledge, and I got to say something really, really quick, that I'm celebrating my 61st birthday with you all, and be able to make this pledge and hear the commitment from all of you is one of the best gifts that someone can get. So hell yes, I'll sign on to it.
Thank you. I appreciate that, and happy birthday.
Thank you.
Ali Marsh.
Yes and yes. Also very enthusiastic to answer and excited to answer this question. I also want to echo with what a couple other folks had mentioned about pushing other candidates and current representatives and lawmakers to sign this pledge. So thank you.
Thank you, Ali. Aisha Mo.
Yes and yes, plain and simple.
There you go. Thank you. Mark Newman.
Yes and yes. Let's represent the people who have told us in all of our campaigning that this is what they want.
We appreciate it, Mark. Dan Sherrill.
Coming.
Yeah.
Yes, yes, and also expand Badger Care for all.
Thank you, Dan. Appreciate it. Rob Slamka. Sorry. Do we still have you, Rob? All right, we'll just move on for now. Jane Swiggum.
I can't open.
Oh, you can just answer this. That's fine.
Okay, yeah, no, yes and yes, absolutely. For some reason, I'm not on the video, but yeah, no. Thank you very much for the opportunity. I'll fight very hard for the cause. Thank you.
Thank you, Rob. And Jane Swiggum.
Yes and yes, and let's do it full Wisconsin. You betcha, yeah.
Love the enthusiasm. Thank you, Jane. Ed Vogt?
Yes and yes, and I look forward to putting the pressure on all those that need it in order to make this happen in the state of Wisconsin.
Thank you, Ed. Emily Voigt?
Yes, and even the dog says yes.
Dogs for Medicare for All. Sarah Yakub?
Yes, and I second Badger Care for All.
Awesome. All right, I'm going to pass it to Rich for the next question, and it's going to be a similar format.
Great, thanks, Andre. So the next question, some of you already actually just answered it. So if you've already answered it, if you already said that you wanted to expand Badger Care to cover everyone, you don't have to answer again. So the question is, short of enacting a federal single-payer healthcare system, or for example, while we're working on doing that, would you support universal healthcare at the state level, including expanding Badger Care to cover everyone without health insurance? And the first person I'm going to call on, I'm sorry, Joni, I can't remember if you answered it or not. Did you?
No, actually, I didn't.
Okay.
I was more concerned with candidates. Yes, I absolutely believe that we need that in Wisconsin. I would fully support it.
Okay, great. And then Michael Beardsley?
Yes, absolutely. I'm running for a national position, but I mentioned real quick, I think we need to be unified on this. So as soon as we can get everyone access, the better. So if Wisconsin takes the lead, great.
Okay. And Mason Becker, did you answer yet or not?
I don't think I did, but yes, I would definitely be on board with that. And I might just add that we might, in that state scenario, have to find ways to get buy-in from the major healthcare providers in this state to make sure it works. But yeah, I'd be on board with that for sure.
Okay. Great, thank you. And Brian, I believe you said yes, Brian Benford?
That's right, I did.
Okay. And Ali Marsh?
Yes, absolutely.
Okay. Aisha Mo?
Yes.
Dr. Mark Newman?
Yes.
Dan Sherrill, I think you said yes.
Triple yes.
Yep. And Rob Slamka?
Absolutely, yes, I will.
Nurse Jane Swiggum?
Yes.
Advoki?
Yes.
Emily Voigt again?
Yes, but we need to make it even better than what it is. As I spoke about real briefly, as someone who has had Badger Care off and on for many years,
Sure.
we need to make some major changes to Badger Care and expand it to include a better, more
Great.
comprehensive dental and vision.
Perfect.
Sorry.
It's okay. And then Sarah Yakub? Yakub?
Yes, absolutely. I support Badger Care for All.
Okay, great. And then I'm going to turn it back over to Andre.
Thank you, Rich. And the last and final question we have here is a yes or no question as well. Would you be willing to put forward a resolution in your city or county backing single-payer healthcare to move our state's leadership position on this issue? And it's going to be a yes or no question, starting with you, Joni.
Yes.
All right, thank you. Michael Beardsley?
Yes, I think this is a smart way to do this. I think La Crosse County actually just did this very recently, so maybe Mark Newman will have an answer for me, but yes.
Thanks, Mike. Mason Becker?
I'd be open to it. I would much rather win my election because my opponent definitely would not be on board with a single payer universal health care. And I'm much more about getting things done than passing resolutions. Resolutions are okay, but I'd rather get us across the finish line.
All right. Thank you.
Thank you, Mason. Brian Benford?
Absolutely. I live in one of the most progressive districts in the state and the country. I'd be more than honored to help advocate for that.
Thank you, Brian. Ali Marsh?
Yes, I absolutely second that. With being in Madison, that I would push forward for a resolution.
All right, thank you, Ali. Mark Newman.
Yes, La Crosse County did it this past Thursday, and it's a good way to promote communication and political conversation in our communities.
Awesome. Glad to hear La Crosse passed that. Dan Sherrill.
Yes, yes, yes.
Awesome. Thank you, Dan. Rob Slamka.
Yeah, absolutely. Short of getting that federal mandate on those issues, we absolutely have to move forward with a resolution on that. It's got to happen. Absolutely.
Most definitely. Jane Swiggum.
Yes, for sure.
Thank you. Ed Voigt.
Yes, absolutely.
All right. Thank you. Emily Voigt.
Yes.
Sarah Yakub.
Hi, yes, people on both sides of the aisle support it. So I'm in a real conservative area, and resolutions are really helpful for showing one another that we're not alone in wanting this for the people of Wisconsin.
Most definitely. So that concludes our questions, and I'm going to pass it back to Rich for a closing statement.
Thank you, everybody, for attending the forum, and thank you, every candidate that participated today. After listening to all of your remarks, I'm 100% sure that every one of you is committed to advancing the cause of universal health care through a publicly funded, privately provided system. And the last series of questions kind of seemed a little silly or maybe even like redundant, but thanks for going through all of them and answering them. And the conclusion was it was a resounding yes on every single question. So you guys agreed to sign a pledge affirming that you were going to stand behind single-payer healthcare, that you were going to back resolutions at the city or county level, and that in the interim, because this probably still will take some time, you were going to promote or try to advance the cause of opening up Badger Care to everybody that doesn't have health insurance. So I think every one of you is extremely progressive on this cause, and I encourage your potential constituents to take a closer look at you because they're exactly the leaders we need. People from our organization, our Wisconsin Revolution, are going to be in contact with you over the next few weeks. We'll give you some time. I know you have elections coming up, an election coming up, but to connect about those last three measures that we talked about, because we'd like to work as part of a coalition with you to advance this cause. So thanks again, everybody, and thanks, Andre, for co-hosting, and I hope everybody stays safe and wear a mask. It is worth it. And listen to science. So have a good night, everyone.
I'm just gonna unmute everybody, and then we're pretty much done. So.
Okay, thanks.
Good job.
Great
Thanks, everyone.
stuff.
Thank you.
Thank you. Thank you very much.
Thanks for making
Thank you,
this
everybody.
happen. Bye, Joni.
We forgot to
Bye.
do our chant.
Everyone.
Thanks for
Bye-bye.
coming,
Bye,
everybody.
everyone.
We really do appreciate
Bye,
it.
Mark.
Join a local, follow us on Facebook and Twitter, and join a local OWR chapter near you. There's links in the chat. Be sure to do that.
What she says.
Hi, Dr. Newman.
Bye, Mark.
Bye-bye.
Thank you, everyone.
Bye, Joni. Bye, everyone.
Wisconsin is going to lead the whole United States in healthcare. Thank you all.
Make Wisconsin a leader again.
Yes.
Yeah. Be proud to live in Wisconsin.
When we organize,
we win.
We win. There we go. All right, everybody. You guys have a great night. And like Rich said, wear a mask if you go out. Have a great night.
Wonderful job, guys.
Thank you, guys. Thanks, everyone.
Good job, everyone. Thanks for stepping up to help. I know I didn't give a lot of instruction until like the minute before, so but thanks.
It worked out.
Cool. Yeah, it was great. It was fantastic.
Sorry, and Andre, I'm sorry I skipped your intro, man. I'm just like sleep deprived or something.
No, you're good.
You made up for it. Yeah, you did. It was good.
I just called it audible. We worked it out.
All right.
Said you're older, Rich.
All right, guys, recording is stopped, and I stopped live streaming.